Nice to see you, Danny CXX. I got some. Oh, hold on a minute. What's that? There's a thing up on. You don't want that. Oh God. Right, we're live on Facebook, and I used to have things I could put up, didn't I? Remember what were the widgets? Anyway, never mind. I never. Oh, look, snowfall. I never had. So, yes, it's if you've got any questions plastic surgery related, then please chip in. If you haven't, don't worry, because I've got some. I'm going to start with this one right here. Do you remove warts? So, do you remove warts? Simple answer, no, simply because it normally doesn't come to surgery. So, warts can be removed with surgery. So it's not like they can't be removed, but we would normally get involved at quite a late stage once non-surgical means had been exhausted. So most warts can be removed with surgery, with non-surgical means, usually salicylic acid, which is that stuff. Anyone who's had children will know this. It's that white stuff, or it's sort of like that stuff you put on it, it goes white, and then you put it on every day, and then you file it down and put more on it. Or you can use cryotherapy, that spray. So the GPs or your doctor will be able to help you. If you have resistant warts or lots of warts, then maybe the dermatologist might be able to help. But most people can be treated with non-surgical means. In fact, a lot of the treatments you can just buy over the counter, and the pharmacist will help you out. So most can be treated with a pharmacist. If they're resistant and they're really problematic, you could then move on to see a GP about it, which could try maybe the spray, the silver nitrate spray, or some more invasive treatments. If they're multiple or continue to be resistant to treatment, then the next stage will be the dermatologist. And it would only be very late on that a plastic surgeon would get involved with it in terms of cutting them out, which would be a last ditch. So the answer to the question, do you remove warts? They can be removed, but how many? I can remember, to be honest with you, from memory, I think once I've done it. So hardly ever. Never say never, but hardly ever. The problem is they're often on difficult places like the foot or the hand, and to cut a bit of skin out of the hand can be difficult because they can be difficult to close. So you're much better off using non-surgical treatments, which normally will sort it out. You know what? This question I get asked a lot. I mean, a lot. Do you do for Instagram? The question is, do you offer VASER lipo or liposuction? And I'll be honest with you, I don't understand why I get asked it so much, because I can only think that VASER has done a good job of marketing their machine. Because there are other forms of assisted liposuction. It's not just VASER. God. And that's the weird thing. VASER's not laser. There is laser liposuction as well as VASER liposuction. So the answer is no. And a lot of people I think tend to use the term VASER just meaning liposuction. And I don't think, well, I might be wrong, but I don't think they're asking because there's something they think there's something tangibly different between VASER and other types of liposuction. So the reason I don't offer VASER liposuction, there's two reasons. One, I haven't got a machine, and I don't think the hospitals I work in have got a machine. I don't think they have. So that's number one thing. You have to have the machine, the VASER machine. And two, I personally, I haven't found a sort of need for it. I think that's not to say there's not a place for it, because there might be a place for it, but I'm not sure about it. So probably I'm not the best person to ask because I don't do it. So you might say, oh, he's saying that because he doesn't do it. But then people who do it might have a skewed view that way. So, I might have a skewed view about it. The bottom line is liposuction is a great way to remove fat. And there are assisted forms of liposuction, of which VASER is one. And the benefits of assisted forms of liposuction, so VASER delivers ultrasound energy to the fat before you suck it out. Other types are, as I say, laser. So there's laser liposuction that delivers laser energy, radio frequency. There's other types of liposuction which assist before you suck the fat out. And I think there's two benefits from them. One is that because they're sort of destroying the fat in some way by delivering energy to it, you can use a smaller cannula to take the fat out. Therefore, they can often be done under a local anesthetic. Whereas if you do traditional liposuction like I do power-assisted liposuction, it normally needs at least local sedation and often general anesthetic. And the other benefit of them is because they're delivering energy to the fat before you remove the fat, they say that it does give some skin retraction. And I think that is a big positive for it, because certain areas I feel don't respond well to liposuction, being the central abdomen and the inner thighs. Those are the two big areas really. On the arms, these are areas where I really don't think liposuction is good because it doesn't remove the skin, and so you're left with hanging skin when you take out the fat, and that's not good. And so if there was a way to tighten that skin without cutting it out, so usually it means a tummy tuck or a thigh lift or an arm lift, if there would be a way to avoid that surgery, happy days. And so people with a modest bit of skin excess who are clearly not candidates for a tummy tuck but want a bit of liposuction, VASER might have a role there. And I tell people that, and what I always say to them is look for someone who does VASER, look to see if they're getting good results, and if they're getting good results and it seems like a reasonable thing, go for it. So I'm quite open about that in those areas where people have got potentially going to have redundant skin and they're not a candidate for a skin excisional procedure, be it a tummy tuck, thigh lift or an arm lift, then one of the assisted forms of liposuction might do it. The problem I've got is I think, might be wrong, take me up on this if you're a VASER practitioner, I think the results are often quite subtle, and that's what worries me. Also, because it's delivering energy to the fat, I'm always worried that they're going to burn. It could potentially burn the skin. I have seen some bad burns from these types of liposuction. Admittedly, they're old. That was maybe, and again, people who might do it today might say, well, that's old-fashioned. They've got ways of protecting the skin and making sure the temperature of the skin doesn't get too hot. So then that might not be a risk these days. But that is in the back of my mind. I have seen some bad results from that. So, but anyway, so I don't offer it. I do power-assisted liposuction. I do offer an assisted form of liposuction, but it's power-assisted, which means it goes backwards and forwards. It doesn't actually deliver energy to the fat before you remove it. And I feel that I can do everything I need to do with that. Whether VASER liposuction gives a tangibly different result remains to be seen, and is probably best off speaking to someone who does VASER, who will say to you, look, this is VASER, this is non-VASER, this is why VASER is good. But as I say, I don't know why it always seems to be VASER. So there are other types, smart lipo and body tight liposuction. Anyway, there's lots of different types. Hey ho, but there you go. So yeah, don't do it. Maxine is got on to Facebook. Yeah, oh, look at this, Mag. What's the difference between having a tummy tuck and lipo? So the big difference is, Maxine, there's quite a big difference. So the big difference between tummy tuck and lipo is that lipo is a lot less invasive. Lipo makes tiny little stab incisions. You put a liposuction cannula in and you suck out the fat. The problem is it doesn't remove any skin. So the reason people need a tummy tuck often is, well, the two reasons are pregnancy and weight loss. So weight loss, if you like, is sort of doing the equivalent of liposuction. It just removes the fat goes. And the reason you need a tummy tuck after weight loss is because the skin doesn't recoil. That is the problem. And the central tummy is an area where the skin doesn't tend to recoil. Other areas it does tend to recoil better, outer thighs, not so much the inner thighs, but there are some areas where the skin doesn't recoil. That's why people need these excisional procedures, of which tummy tuck is one. So tummy tuck is an excisional procedure where skin is excised. A liposuction, no skin is excised. So tummy tuck is a much bigger procedure because it gives you a big scar along the lower abdomen, but it cuts skin out. But that's why these operations exist. That's why inner thigh lifts, you don't get an outer thigh lift because the skin on the outer thigh tends to recoil. That's why liposuction is good for the outer thigh because the skin tends to recoil, but it's not so good for the inner thigh because the skin doesn't recoil. Same with the arms. That's why arm lifts exist, because the skin tends not to recoil. So there's actually quite a big difference between the tummy tuck and liposuction. In that a tummy tuck is a much bigger operation. There's much more downtime. There's much more scarring. There's much more risks in terms of wound healing, etc., etc. So there's a lot of bad things about a tummy tuck compared to a lipo. The main good thing is it takes the skin out and it tightens that skin, and it really can transform the look of your abdomen in a way that there's no way lipo can do. And even like this VASER and things like that people say cause skin retraction, it's never going to be as good as a tummy tuck. No way. Whether there's a place for it between those people who aren't candidates for tummy tuck but what lipo may be. In my practice, I pretty much don't do liposuction to the tummy, but pretty much just don't do it, because it just it doesn't give good results. Oh my god, I've got low power on my phone. How schoolboy is that? Don't worry, guys. Don't worry. It's all right. It's okay. I've done this before. I'm a pro. It's okay. Just talk amongst yourself. Just put the power in. There you go. Power's in. There you go. Why is that flashing? Why is the microphone flashing? Is everything working on Instagram? The microphones. I've got a red flashing light. Does anyone know? Does anyone know what? Look at this. I've got a red. You can see that. That red flashing light in the corner. What's that mean? It's at the corner of the see, that's the instrument. Oh God. Anyway, anyone on Facebook know what that means? Oh, stop now. Oh God. Anyway, push on. Okay, so yeah, big difference in tummy tuck and lipo. Similar theme, Sahib. Thank you, Sahib, for tying in. It's almost like we've planned this. Do you offer liposuction on the upper abdomen with a tummy tuck? Very good question. So that, Sahib, is one of the big differences between one of the things that they talk about a Brazilian tummy tuck. I don't know if you've heard of a Brazilian tummy tuck. People talk about the Brazilian tummy tuck. And I did a blog post about it saying, look, it's just a tummy tuck. It's not really, that's not much different about it. But one of the differences is whether you do liposuction to the upper abdomen, to this bit here. And the answer to your question, Sahib, I do not do liposuction to the upper abdomen with a tummy tuck. So I worry that the skin flap, the vascularity, the blood supply of that skin flap will be compromised because that skin flap is being pulled down when you do a tummy tuck. And I worry it's going to compromise the healing of the skin. Also, it's very rarely needed because even if you feel like you've got a bit of fullness above your belly button, it gets stretched. So the skin that goes from your rib cage to your belly button gets stretched all the way down. So actually, even if you feel like it's got a bit of fullness there, that gets pulled down. Again, it's really massive weight loss patients who maybe have rolls of fat there and have got a lot of fat up there. And so in those situations, I would recommend a tummy tuck later. Not a tummy tuck, a liposuction later. I would do the tummy tuck and I would do liposuction to the upper abdomen later. Personally, I wouldn't do liposuction to the upper abdomen at the time of a tummy tuck. Personal view, I know some surgeons do it, and presumably they don't get wound healing problems. Otherwise, I wouldn't keep on doing it. I'm just worried about damaging the vascularity, number one. And number two, to be honest with you, I very rarely see a candidate for it. Very rarely. Because most people, even though they feel they've got fullness there, once it gets pulled down, there's not as much fullness as they thought there was going to be. But lovely question, Sahib and Maxine. Gold star to both of you. If I could thumbs up, I would. Well, I can. There you go. Double thumbs up. Now, Liz, if there's more than double thumbs up, Liz has used the Ask JJ hashtag. People, I'm just saying, you know, Well done, Liz. Thank you for that. Hashtag Ask JJ. I can all start. Oh my God! I'm ignoring. Oh, I'm ignoring it. Sorry, I'm ignoring Instagram. And there's messages on Instagram, and I've neglected it. Right. Sorry. Oh, no sound. I've lost your sound. Oh, Instagram. The microphone thing was flashing. I don't know what that meant, but it obviously meant no sound. So is the sound working now? Stargazer, you're lucky I haven't answered your question yet. So technical difficulties on Instagram there. Sorry, is that real? Okay, Liz, it's all the excitement. It's all the excitement of the night. So Liz, I'm going to answer your question now. Hashtag Ask JJ. Is there anything I can do to ease the discomfort I feel where I had lipo to my waist? I can't describe the feeling, but it's sore and tender. I'm 4 weeks post-op. Not really, Liz. I mean, are you my patient? If you're my patient, we'd have given you a binder. Did we give you a binder? Anyway, whoever's patient you are, you should have. Have you got some kind of support? If you haven't got some kind of support, what is good is, you know, those big pants you get. Well, first thing, if you're not my patient, Liz, you should speak to your surgeon. That's the first thing. If you are my patient, speak to me, which you are doing, which is good. Carry on. But if you're not, speak to your surgeon. But if you haven't got a binder or a support garment, then the big pants, you know, the big pants, the big figure hugging pants you get in M&S and other outlets, then they can give you some nice support. And I know a lot of, when I say that to people, they often say, look, I'm having this surgery, so I don't need to wear these big pants. But I understand that, but just when the immediate post-op period, this big pants can be helpful. So yeah, big pants is what I'm saying, / support garment / talk to your surgeon. But it can be uncomfortable, Liz, and 4 weeks is not long post-op. I've got to be honest with you. It can be uncomfortable. Thank you all for your questions. Now, Instagram, have I got sound? Can you hear me? Instagram, can you hear me, Instagram? Is the sound? It's back again, right? Assume the sound's working. Stargazer's got a question. Stargazer, what you got? I have quite slack tissue in my breasts. Current implants are under the muscle, but would like over. I'm worried they would cause my already stretched skin to sag quicker. Am I right? Oh, here we go. Second part. Sternal notch to nipple current at 22, so not really saggy at present, but pre-childbirth, so worried this would contribute also. Yeah, so yes, we can hear. So you can hear. So yeah, nipple to sternal notch distance. So that's the measurement we make from here to the nipple, which is a good marker of the droop to your breast. So your mid nipple to sternal notch is 22. So that's absolutely right. There's no sag there, Stargazer. So current implants are under the muscle. You would like them to be over. A worry they've caused my already stretched skin to sag quicker. No, you're not right, Stargazer. The thing that sags, Stargazer, is your breast. So your breast usually sags, and the implant stays where it is often. And like you just said, pre-childbirth, if you have children, that will make your breast sag, or potentially might make your breast sag. And also if you put on and lose weight, those two things are going to make your breast sag. So having the implants under or over the muscle is irrelevant. The muscle can actually hold the implant high sometimes. So you could look like your breast is sagging more, but that's not an issue. The issue is, the only thing I would be worried about, which is probably a slightly different thing, is I would be questioning why they put the implants under the muscle in the first instance, because you're now considering having them on top of the muscle. So I'm sort of assuming you're quite slim without much subcutaneous cover over your chest, and if that's the case, you've got an increased risk of rippling or seeing or feeling the edges of the implant if you put them on top of the muscle, although you have got benefits of putting them on top of the muscle in that they're less likely to sit high and wide and animation if you do the gym, etc. But I'm assuming you've got a reason to want them on top of the muscle. But in terms of the sag, no. The only thing is, you know, obviously if you go for bigger implants, that might be an issue. But just changing from under to over is absolutely fine. Your skin will sag at the same rate, whether the implants are on top of or beneath the muscle. And it doesn't sound like they're sagging at all, Stargazer. Sometimes you're being a bit harsh on yourself. Nipples still launch distance 22 centimeters. Oh, not sag at all there. Hope that's all right, Stargazer. Hope the audio's working all right on the Instagram. Hope the audio's all right. Hope you heard that. Gastric Fantastic's in. Gastric Fantastic, is the audio? Can you hear me all right? Yeah? My microphone was flushing earlier, so I think there was a problem, but I think I'm all right now. Right, no comment. Can you hear me? Oh, they're sitting high and wide, went in to have them changed, but woke up with unders again. Ooh. Ooh. That's... Yeah, sitting high and wide is a problem with putting them under. So you went in to have them changed to put them over, and you woke up and they were under again. That's awkward. Yeah, it's a balance, Stargazer. What I would say to you, Stargazer, is no one's trying to harm you, and I think they're probably trying to do the right thing. Whoever did that, they probably thought, oh, they're worried the rippling. I mean, they really should have talked you about this before, shouldn't they? That's the problem. Communication. They should have taught you about that before, because, you know, there are benefits in putting them under the muscle, no question. There are benefits, particularly in very slim people, but there are also risks, and you are suffering from the risks because you are having them high and wide. Each other. Having said that, Stargazer, again, it's not to defend anyone because they need to communicate with you, but, you know, if they are sitting high and wide, they need to be under the muscle, because I you know, full disclosure, I have to lower a set of implants. I normally say about once a year, which I think is probably about right. About once a year I have to lower a set of implants. They're pretty much always under the muscle, but I don't necessarily change them to over the muscle. You can lower a set of implants and keep them under the muscle. You just have to release more of the muscle. Similarly, if they're sitting wide, they maybe didn't release the cleavage enough. So you can go back, you know, it wouldn't be unreasonable to go back and revise the pocket and try and release more of the pocket immediately, to release more of the muscle inferiorly, try not to release too much, but to try and make the pocket better and make them sit less high and wide. But, you know, if you were expecting them to go from submuscular to subglandular and they didn't, then that's obviously a problem. But yeah, that is an issue. Oh, I'll still want that question up. I knew. My member Anne had a thigh lift 12 days ago and one is still weeping badly. Is that normal? I wouldn't say it's normal, Gastric Fantastic. I wouldn't say it's normal, but I would say can be a thing, and particularly with a thigh lift, particularly if the scar's up in the groin, because that is a bad place for healing. Now, the good thing is it's hidden, so that is the good thing about that scar up in your groin. But it often takes a long time to heal because you're walking, so it's moving all the time. Because you're walking, you get that movement. It's hot, it's sweaty. It's a bad place for wounds, and wound healing is a problem. But Gastric Fantastic, you know what I'm going to say? Always best to stick with your surgeon. So she should be speaking to your surgeon and working with the surgeon, making sure she's keeping clean, dressed, whether she's allowed to shower and wash, whether she's going to change the dressing herself. Because if it's weeping a lot, I'm assuming that dressing is getting wet. So this is where wound management comes in. You know, so I don't think that's, you know, crazy normal, to be honest with you. I think is a thing with the thigh lift. But it does need to be, you know, managed, because you got to, you know, you worry about infection, stuff like that. But yeah, I wouldn't say it's abnormal gastric. And good luck to her. Good luck to your member Anne. Good luck, Anne. Do you do any kind of bum enhancement surgery? Hashtag Ask JJ. Nice. No, Danny. I don't. Nil. Niente. No, I just never really embraced it. The fat grafting has all become a bit. If I did any, well, no, I was going to say if I did anything, I'd do fat grafting. I might take that back. But anyway, the fat grafting has all been a bit like, oh, doom and gloom, because all these people died. There's a whole group of surgeons says it's fine, and the mortality's, you know, not out with normal realms, and there's a whole some people say it's really bad and all that. So anyway, we're not supposed to do it, basically, the fat grafting. Some would say that is going back to implants, which were the things they did before fat grafting. And, you know, I've seen people present who do a lot, who say, you know, if you're doing breast implants, you know, you should be able to do it, although there is a learning curve with anything. But I just don't want to get on the learning curve, Danny, if I'm quite honest with you. So no, I don't. I think, you know, and I don't think many people do. In this country, I don't think many people do. Again, talk to people who do a lot of it, say the fact that we don't offer it means that we're not seeing the patients. So we think there's not a market for it. But what they'll say is when you start offering it, there is a market for it. So I imagine there might well be a market for it. But no, I don't. I don't, Danny. Sorry. Stargazer. I do have a handful, so to speak. So they should be okay, theoretically. To be honest with you, Stargazer, the bigger your breasts, I'm assuming you're talking about the breast now, the more they're going to droop over time. So the more they'll be acted on by gravity, regardless of the implants. So in that respect, the bigger they are, the worse in that respect. He's on holiday. He's on holiday, the weeping thing. Okay, so has he got someone covering? Local hospital said it's a blood blister. Okay. Sorry, I meant surgeon on holiday. Lol, asked JJ. And thanks for replying. You're welcome. And when we're supposed to have people covering when we go on holiday. But anyway, yeah, I think 12 days is not bad. But I think, has he got a nurse or something who can look after you? So I think or Anne needs to be looked after by someone, because, you know, she needs wound management if it's weeping, and the thighs are difficult areas which are prone to wound breakdown and infection. Handful meaning I should be okay with overs. Oh, yes. Okay, gotcha. The other thing, you'll look for the soft tissue covering your chest as well, Stargazer. So, you know, when you can see the ribs and stuff, I think, ooh, should I be going under? So I'd be looking at your chest here to see whether you've got enough cover. But yeah, if you've got a fair bit of breast tissue, that's helpful. But there must be a reason why they both put them under before. So it's like, unless you put on weight since you had the original surgery, maybe. That might be a thing. Might be. Do a question over here if that's okay. What is the difference between a 15-minute and a full consultation? So the 15-minute ones are usually virtual, so like this. The fulls can be virtual too. We do virtual full consultations, but the full virtual consultations include an in-person consultation where we examine you. So that's one big difference. The full, whether they're full is done virtually or not, it includes an in-person one where you'll be examined. The other thing, the full, the 15-minute one is really what I would say is a chat to answer your questions, a bit like this, to be quite honest with you. So you can save yourself 35 quid and come on here and ask me questions if you want, but it's just a chat to ask questions. And, you know, if it's I'm your surgeon, fine. If one of the others is a surgeon, that's fine too. But it's just a chat, ask questions, and we can, you know, talk about what's involved and stuff like that. The full one is a bit long. Well, is longer. Talk about before and afters. Talk about risks, complications, what's involved with the surgery. It's basically more involved. Basically, bottom line. So it's a bigger deal, a full one. So yeah, is everything all right with the internet? It's an awful feeling. So yeah, a full one is a longer consultation and includes an in-person consultation at the clinic. You don't have to come back you don't have to come to the clinic if you've got a problem with implants or something like that. But mostly if it's tummy tuck, breast implants and things like that, then it's usually good to come to the clinic. We examine you. We can look at your tissues. You know, with the full virtual, you can send us a photo and we can give you an idea. But there's no substitute for an in-person consultation, which you get with the full consultation. And the other thing about a full one is the full one, we're looking at renaming it actually from a full consultation to the clinic passport, because actually when you come for a full consultation, however you come into that, whether it be a virtual or a full or a in-person, it includes the follow-up consultation, so you can come back. So if you come and you've got a problem with the implants, you can come back in a year. We'll check you out every year. So if you come and you want to talk about implant sizing or something, you can come back next week and do it again and again and again. So the full one sort of unlocks that for the clinic, that opening to come back as often as you want, before and after surgery. So even if you don't have surgery, you can come back if you're, you know, thinking of having something done, you're not sure, come back in a few months' time, we'll talk about it again. Or if you think, I definitely want to have something done, but, you know, there was too much information on the clinic, that clinic, come back next week, we'll go over it all again. So the full one sort of unlocks that. So that is another big difference, you know, full and the 15-minute. And so that's why I've thought about, it's not really a consultation, because that's why I've been thinking about calling it clinic passport, because it sort of unlocks the clinic to come back as often as you want. So there is quite a big difference there as well. What's going on, Han Paul? Are your implants too wide if they're causing a farting type noise when your arm hits down off them? It's caused from a vacuum space in my arm. It's really embarrassing sometimes, so I'm thinking they're just too wide for my frame. The farting noise, Stargazer, is usually immediately post-op, because there's air trapped in the pocket, and you often get farting noise or squelching, perhaps a better way of putting it, but I know what you mean. So that's usually immediately post-op, Stargazer. Are you quite soon post-op, like in the first few weeks? Because that noise is usually associated with the first few weeks post-op, rather than, you know, later. It's different to that noise. This is external. Oh, like when people do that, I can't do it. My son can do it like that. No, is it? Whether they're too. So there's two things here. So they might be too far apart. If that's a cosmetic thing, you'd have to look at the width of your frame, and that's really important to get the width. 18 months post-op width right, because if they are the width might be right, but they might be too wide, hence the muscle thing, or the implants might be too wide as well, or both. So, you know, if the cleavage is wide and they're sticking out too much, I mean, you could medialize the whole thing and they'd look all right. I mean, I think what I'm trying to say is you need to be examined and measured and see if the problem is simply the implants are too wide, but they were the right choice for your frame in that they were the right width, or were the implants too wide as well, which is going to exacerbate the problem, because even if the cleavage is a little bit off and they're a little bit wide, the cleavage, if you've also got a wide implant, that's going to stick out even further on the width. So that's, if you're going to have something done, those are the things you'd have to look at, whether you're going to go for a narrower implant, or whether it's enough just to medialize the implants. Park a bust in the middle, so maybe they're just too far apart. Yeah, those really wide cleavages, Stargazer, is usually when they're under the muscle and they haven't released the muscle enough. And I can totally understand, being a surgeon, I can totally sympathize why people don't release the muscle enough, because there are big blood vessels here. And when I did breast reconstruction, I used to take some tissue from the tummy and put it onto the breast, and I'd take a rib out and use those big blood vessels to plumb it in, and one of those blood vessels would supply a huge amount of skin. So there are really big perforating blood vessels there, and so when you're doing that dissection under the muscle, it is a worry. You know, I think we've all had it where you've nicked one of those blood vessels and it's bled a lot, and it is you know, difficult to control and all that. So therefore people can sometimes worry about releasing. It's a lot easier to think, well, get the implant in, should be all right, you know, without releasing the muscle enough. So you have to really work to release the muscle when you're putting them under the muscle. Otherwise, yeah, it contracts and pulls them wide, and it looks like you can park a bus there. So I've got to be honest with you, Stargazer, I can sympathize with your surgeon, but at the same time, it doesn't help you, does it? Because you don't like the look of it. So I think sometimes you have to be bold and go there and think, I'm going to release that muscle, and just be really careful about it. Look for the blood vessels before they start bleeding, and, you know, just be really careful about it. But yeah, it sounds like you definitely got a width, a muscle pushing the implants wide problem, and then you'd have to look at the width of the implant to see if it's the right width for your frame. Yeah. Sorry, you got a problem, Stargazer. It's difficult when breast implant surgery is not without its Problems. Oh, hold on a minute. Sorry. Went in for a revision because of this. Decided for overs and woke up with. That's not good, is it, Stargazer? Unless they gave you a good reason. Did they give you a good reason why that happened? I mean, I'm trying to think if I've ever changed this. You know, there's not many reasons why you would say to someone before, I'm going to put them from under to over and then not do it. I can't what's the word, justify, or I can't understand why that will be done. Not enough tissue apparently. Yeah, but you can assess that pre-op. Should really be able to assess that pre-op. I would suggest you don't have to discover that intraoperatively. That's something that you would say pre-op. You haven't got enough tissue. I'm going to keep them under. You wouldn't say, well, anyway, never. I don't know. I'm not in their shoes. Anyway, I can see how you're annoyed about that, Stargazer. But, yeah. Anyway, tricky one. That, yeah. Oh dear. Yeah. Yeah, that is cheese. Did they say they tried to medialize the pocket and release the muscle more to lower it though? I mean, as I say, they should still be able to release the muscle even if they didn't change the plane. They should have tried to correct your problems by releasing that muscle medially and inferiorly to let the implant sit down and medial. But maybe that didn't happen. In which case, what did they do? Anyway, here we go. Do you accept NHS referrals? No, I don't accept NHS referrals. I left the NHS in 2012. There are places, private places, that do what's called choose and book, where you can have NHS treatment at that place, at the private hospital. And I know private places do that, but I don't do that because that's usually for stuff like hernia repairs and things like that. Because all the work that I do is mainly it's breast and body contouring, is cosmetic. And so the NHS don't do that work, I guess. So you wouldn't get referred by the NHS to see me because all I do is cosmetic breast and body contouring. The only thing I guess would be moles and things like that. But no, we don't do any. It's fully private, self-pay. We don't accept any NHS referrals. As I say, simply because the things that we treat are not covered on the NHS. Breast lifts, breast reductions, breast implants, tummy tucks. These things are not covered on the NHS. So it's not like, that's just it. Yeah, just do private work. Don't do any NHS work. Thanks for your advice. Helps me to understand it better. They said they did, but the results don't show that. Yeah, it's tricky. It's tricky, Stargazer. I can see, but I can definitely see both sides, and I can definitely see your side, how you could be cheesed off and think these blinking surgeons are, don't know what they're doing. But I can also see the surgeon side, that they're, trying to do. It's difficult under the muscle. People often say, "Oh, under the muscle is more natural, etc., etc." But you can have problems like you're having with under the muscle. So yeah, it is difficult, and it's difficult when you have problems. I'm sure they did try. Jackie cries, "Where you been, girl? Where you been? What time is it? 7:45, Jackie. What are you playing at? Honestly, God, dear, you've been watching football, haven't you? Honestly, that's why the numbers are down, isn't it? It's a football. It's not a football. It's the post-football stuff." Right. Well, I'm out of questions already. Jackie, you just arrived. I'm out of questions. I do have some. I'm out. I'm declaring myself out of questions. Anyone got any more questions? Stargaze, you got anything? Maxine, Sahib, got anything? Right, without further ado, I've got to end these a bit more professionally. Don't you think? Not very professional saying you've got any questions. I'm just going to end it in a professional way. Right. Oh, God, sorry, I've got to go. Is that the time? I've got another appointment, very busy man. So I've got to go to my other appointment. So if you have any questions, please post them here, or here, or there. And I'll answer them next week, 7 o'clock, right here on Instagram and right there on Facebook and YouTube. Where's YouTube? YouTube's there as well, isn't it? I'll leave you be. Stargazer, you've buoyed this up, so thank you for your questions. And you know, I don't know what to say, because I was going to say I hope it settles, but it's been a few months, hasn't it? Have a nice evening, Maxine. Lovely, good. You too, Maxine. You too, Stargazy. Don't worry, Jackie. Don't worry. Thank you, Jackie. And I will see you all next week. I'm going to check out Facebook by pressing this button here.